We have those herbs naturally. Unless you make the diagnosis precisely, diagnosis precision is very, very important, not a differential diagnosis. You treat classical Ayurveda, but understand the client's problem thoroughly. Do the proper screening in depth. For that, we need a support from the modern practitioners. So I am there to lend my support to my team of Ayurveda doctors to go for the depth of evaluation, screening, diagnosis, and if needed, collaboration of medicines. The end beneficiary is our clients. So our patients are really gifted because we are transparent. We are making them understand. They may not know the disease pattern. They do not know what they are undergoing. But as a doctor, we take it as a moral responsibility to counsel them, to engage them, to make them understand what is this disease, how this disease has come to your body, and what are the reasons for this disease to be moving forward in a deteriorating manner. Why is disease multiplying? Why this disease bringing with associated diseases and all? Why the disease is getting aggravated by adding multiple medications? And why it is not settling in your body? So unless you give such a clarity to your patients and clients, they will not travel along with you during the course of treatment. They will not understand the seriousness of the situation. They will be lost. They will not bother. They will not give the proper attention for this